Well, here we sit. The feds took over health insurance, and it's a royal mess. This is how we get out of it without hurting anyone and give people back what they lost, a choice. I'm an insurance broker here in central Missouri, and I've been helping folks with this stuff for about 23 years, both before and after Obamacare, to fix the basics, and we can start now. Here are 5 essential steps to fix the basics, and we can start now. Number 1, allow companies to sell and people to buy any type of insurance they choose to. Currently, there is one type of federally mandated insurance available. Regardless of the company selling it, every policy must include every mandated benefit and feature, making every policy essentially the same. Here is a partial list of mandated benefits and preventative services. Obviously, they add to the premiums. This is the preventative services that have to be covered with no deductible and no copay, so they have to be free on every policy. And you can see the list here. I'm going to go to the next page, and then we got more of them here. And again, all of these have to be free. The insurance company has to offer them with no deductible, no co-insurance, in-network, cost you nothing. And then here's a few more. And this is what's called the essential health benefits. These are items that have to be included in every policy that's sold. Not necessarily without deductible, but they have to be included in every policy. Perhaps the biggest driver of cost is guaranteed issue. Under the new rules, no one can be turned down or charged a higher premium due to health. That might be great for the guy with no insurance who is 350 pounds and just had a heart attack. But the healthy 25-year-old gets screwed, and so do most of us. It does not work, and it's not insurance, but a benefit program that you have to buy. So let's take a look at what's available, shall we? You can follow along at healthcare.gov. This is a quote on a 25-year-old male, currently available. This is the lowest price bronze plan. And you can see the premium is $329. Deductible is $5,450. Maximum out of pocket for the year, $7,150, which is obviously high numbers. Now, let's look a little bit farther into it. Same quote that we're looking at here. And at $45,000 income, which is how I quoted it, he would get no subsidy at all. In other words, he would pay the true premium himself. Lower his income to $35,000, the government is going to kick in $76. At $25,000 income, the government, you and me, however you want to say it, is $212. They're going to kick in towards premium. And then at $14,500, it's going to be free. Now let's compare it with a medically underwritten plan in 2013, the last time that was allowed. Here's the rate sheet for that plan. The old network included both hospitals in Columbia, not just one like the current plans. The old plan has around a $5,000 deductible, and so does the Obamacare plan. If we look at the premium on the underwritten plan for the 25-year-old, we would be looking at $54.92 male, $76.28 female. Huge difference, obviously, in premiums. Let's look at one more premium, the Missouri High Risk Pool. The pool was ended in 2014 due to the Affordable Care Act. As we can see, the rates are significantly higher than the underwritten plan, but still less than current plans for most everyone. And that pool served only the sickest people with no other options. Let's go back here to the 25-year-old real quickly, and we'd be looking at 192 male, 340 female. And again, this pool was only for the most sick people who could not get insurance anywhere else. Now let's look at just one more quote before we go on, and we'll do exactly the same thing. This one is on a 55-year-old couple making $65,000. They would get no subsidy. Their premium for the cheapest bronze plan, same one we were looking at before, $1,461. Obviously not affordable for most people. You lower their family income to $60,000, and you get a subsidy every month that the government pays towards this premium of $1,090. So that would leave them paying about $400 and some a month only. At $45,000, the government picks up $1,232. At $30,000 family income, it's free. The government pays all of the premium for this couple. On the underwritten plan that we were looking at, the one from back in 2013, let me pick that up again real quick. That plan. Same deductible again, same plan we were looking at, the 2013. You could actually do both the husband and the wife for $361.83. Huge, huge difference, obviously, in cost. Then again, the high risk pool. If they were to go into the pool that is only for the sickest of the sick people who cannot get insurance anywhere else, 2013, same $5,000 deductible, $1,321. Still less than the Obamacare plan, which is crazy. So, are we starting to see why having a real choice is so important? Number two, let people with old plans keep their coverage and not be punished. Many have already lost their old insurance. Let me show you here a list. This is a partial list of insurers who are no longer offering insurance here. In 2008, pre-Obamacare, there were 11 to 15 companies selling individual health insurance in Missouri. Today, there is one company left on the exchange. All the rest have gotten out, offered themselves up to be bought out by larger companies, or gone bankrupt outright. Because of this, many of my clients have been forced to change companies 1, 2, or 3 times since Obamacare. Some have been able to keep their coverage, but will be forced off their forced off their insurance and onto a new compliant plan at the end of 2017 when transitional relief ends. The file cabinet behind me here is full of my old clients who will lose their coverage the end of 2017. In what universe does that make sense? Kick people off coverage they have and want to keep so you can force them to buy what they don't want. Point number 3, stop fining people 2.5% or more of their family income for failing to buy Obamacare. Here's a chart that shows the penalty, and you can see it's gone up over the years, 2016 and beyond. If you don't have affordable care coverage, 2.5% of your income, or $675 per adult, $347 per child. And they're going to charge whichever is greater when you file your taxes at the end of the year, and a lot of you probably have experienced that already. Number 4, reinstate the Missouri high risk pool for those without coverage or the ability to get it. I used this for a handful of my clients, and it was critically important for them. We need it back. Number 5, pare the Obamacare subsidy back to 50% of actual premium after 1 year, then eliminate it after 2. If people want to keep Obamacare coverage permanently, and there is a company that wants to sell it, no problem, but they pay their own premium. As companies re-enter the market and are able to sell coverage people actually want to buy, much more affordable options will be available again, and most people will take them. By the end of year 2, hardly anyone will want an Affordable Care Act policy. Sanity will have a comeback. Now, welfare for the truly needy is a legitimate discussion, but a separate one. Let's not destroy the innovation, choice, and value created by a free market in search of a government utopia for all. Let's not confuse having your neighbor pay your premium in the form of a subsidy for affordable health insurance. We can unwind this and hurt no one, and we can start now.